Nearly 100 first responders in Rock County are getting the coronavirus vaccine slightly ahead of schedule. Adam Duxter is live with why this is something they say they weren't planning on, but something they were prepared for. Adam?
Roughly 100 first responders made up of firefighters, police officers, and sheriff's deputies are getting an early shot at getting the shot, thanks to a surplus and some very thorough planning. It was just 8 days ago, 2,000 shipments of Pfizer's COVID-19 vaccine were delivered to Mercy Health in Janesville. But on Monday, those in charge of the vaccine were faced with the problem.
Once it's thawed out, it has to be used.
Extra doses with just hours left on their lifespan.
I got a call from the pharmacist, and he said we have about 100 dosages left. We need to get these used or they potentially could go to waste, and we do not want that to happen.
Dr. Jay McNeil says that's when he made 2 calls, one to the Rock County Sheriff's Office and another to the Janesville Police Department, telling them they had just a short amount of time, but nevertheless a chance at the vaccine.
Everybody's, trying to work together.
The same goes for firefighters in Beloit, who say they got a call from Beloit Health Systems telling them too there were extra doses.
We're getting contact and saying, hey, can you send some staff up if you have some that are interested? And so that has been kind of the process.
Deputy Chief Joe Murray says that allowed nearly half of his staff to get the vaccine. And he says this is an advantage until they can get their entire staff and the rest of first responders in Beloit vaccinated over the next few weeks.
It's kind of new ground. So, it's not going to be perfect, and there's going to be bumps, and there's going to be areas where everybody's going to learn how to improve it for the next time. Hopefully it'll be in 100 years when we're all long gone. But I think there's a lot of opportunity to learn from this and to improve.
And Murray says the state's guidelines for vaccine rollout allow the first 3 groups in line to get them all simultaneously. And while the general public won't expect to see vaccines until probably later this spring, he says the less that goes to waste now, the faster the process itself moves along.